Hello everybody, this is Dr. Saikiran speaking from the Department of General Medicine at People Tree Hospitals, Yeshwanthpur. Recently there has been an increase in the cases of fever and cold and upper respiratory infections. As you all know, there is an increase in the cases of influenza A virus, and especially the strain everybody is aware. It is H3N2 influenza A virus. So coming to the symptoms of influenza A virus, patients can have fever of 3 to 4 duration, runny nose, cough and sore throat, and some patients can present with a little bit of serious symptoms. And also patients can have a lot of myalgias or muscle aches going on, and they can have decreased appetite, and some patients can have nausea, vomiting and loose stools also. So who are the people who are at risk of developing this disease? So basically children who are not yet exposed to the virus can get ill associated with influenza A, and also elderly people or immunocompromised patients, like patients who are on chemotherapy or transplant recipients, or elderly with a lot of diabetes and hypertension and other respiratory diseases like asthma, COPD, and other chronic illnesses. So the other risk factor for getting influenza A virus is because of the urban setting, because we have high levels of pollution in the air that can actually damage your upper respiratory and lower respiratory tract, leading to increased vulnerability to such infections. This influenza, we did not worry about it being a pandemic like COVID virus or coronavirus that we have seen over the past 3 to 4 years. So there is nothing really that we need to worry about in that sense. So coming to the treatment aspect of flu, so when they come to us, we give them supportive treatment, including paracetamol or Dolo and simple cold and cough remedies that we can give. Sometimes we use antiviral for the appropriate patient, and from your end to prevent spread, you need to wear masks, as we all know, and the other thing is you need to you can consider flu shots for prevention of the disease, and also hand hygiene is another important thing that we can easily follow at home and educate others about the same thing. Also avoid foods which can increase your cold symptoms and upper respiratory symptoms by avoiding food directly coming from the refrigerator, and also don't eat or go to a food joint wherein everything is taken care of in terms of hygiene, etc. And lastly, it is airborne disease, so we need to make sure we avoid crowded places and wear mask if it is possible, although it is not recommended. But if you think it is a crowded place, you can definitely use masks to prevent spread.